You know, we don't know this for sure when we start treating a patient with a curative intent. Then the aim of that treatment is always to have cure. But we know, sadly, for colorectal cancer, that 50% will have a systemic relapse. That means that they will develop metastatic disease later on after the surgery. For colon cancer, not for rectal cancer, for colon cancer, we try to minimize that by giving chemotherapy after the surgery, but still many will relapse. So we are not stratifying the patients correctly in terms that we don't find the right patients to treat, and we probably also we over-treat a lot of patients that wouldn't need that treatment because we do not have the biomarkers to select the patients. Mm-hmm. And it is important because to find the non-responders, because they won't benefit from the therapy, so they should be offered something else. That's the main objective, actually. It's also an objective to see, to try to profile the non-responders' tumors in order to try to find some biomarkers to stratify for those new treatments. I basically always get excited. We were excited about the ability to predict the radiotherapy response, since there are a lot of people that don't see radiotherapy as a targeted therapy, but it is. So it was very cool to show that it was such a close connection between kind of classic radiobiology and molecular biology. So we were very excited about those data. That data, right now I'm very enthusiastic and thrilled about the data where we have profiled the tumors of the patients that develop metastatic disease. I guess partly because that paper was accepted for publication yesterday, so I'm very thrilled about that. That could be used to stratify patients for adjuvant therapy, that is therapy after the surgery, in order to minimize or lessen the risk for developing metastatic disease. But that, of course, also will need clinical trials to find out. We think, based on the data that was now accepted, that we can do so for development of metastatic colorectal cancer. I have to be specific here. It's on that patient group. It's a huge patient group. So.